Patient hosts are community members from all walks of life who volunteer their time serving patients admitted to the hospital. They are retired teachers, insurance and real estate agents, nurses, dentists, housewives, business owners, and paralegals who volunteer for a variety of reasons. Some have experienced a life-altering healthcare situation, either in their family or personally, and desire to be part of the healing process for others. Some patient hosts are retired from a medical career and appreciate the opportunity to continue caregiving in a non-clinical role. And some patient hosts simply have a heart of compassion and a strong desire to give back to their community.
As a retired registered nurse, I thought, oh, this is a chance for me to still relate to my patients and to work with them and bring a little piece of myself to the patient.
Since I retired from teaching, I've been looking for things to be able to give back to the community and particularly be involved with people. And the Patient Host program provides a wonderful opportunity for that.
When a patient arrives on a unit, our clinical staff communicates important information to the patient and their caregivers to ensure a safe and comfortable care experience. This information includes clinical details about medications, tests, and treatments, along with helpful daily care tips the patient needs to know. To share communication responsibilities with the clinical team and free them to do what they do best, care for patients, a volunteer role has been established at Allegiance called Patient Hosts. These valuable volunteers take the time to share critical non-clinical information with patients and their family members, serving a key role for both communication and comfort.
Patient hosts are a great addition to our unit as they become this liaison between the staff and the hospital and the patients themselves. Sometimes they spend time talking about the things that staff sometimes forgets to talk about. Where to find things, answering questions, where should my loved ones park. So they really become a bridge of information.
While the clinical team of physicians, nurses, nursing assistants, technicians, and therapists provide important medical care and information, patient hosts step in when patients have settled in their rooms and assist the clinical team by walking patients through key areas of the Allegiance Health Patient Information Booklet. Patients are made aware of important items, such as their rights and responsibilities, the locations of restrooms, and how to order food. They are encouraged to take an active role in their care by learning how to prevent the spread of infection and how to contact staff if they have a concern. Hosts encourage patients to jot down questions in the booklet to share with their care team.
The patient hosts have been very instrumental in allowing our staff to do nursing duties. It takes the time away from the staff so that they can focus on what they need to do from their nursing standpoint, and has really opened up a nice venue for the patients to be able to have communications with the community partner hosts.
Patient hosts receive extensive training for their role over 2 4-hour sessions. They learn how to introduce themselves following Allegiance Service Excellence model and how to interact with patients in various states of health and from various backgrounds and cultures. They learn how to listen and address a patient's concerns and to ask questions to ensure patient issues are addressed at the point of care rather than after the patient has been released. As a patient host, your time with Allegiance Health patients will be a worthwhile and fulfilling investment in the lives of those we serve. And with hundreds of patients to serve each day, many volunteers are needed to make sure we are providing the best care to every patient, every time.
In my dealing with an elderly gentleman that seemed to have a lot of anger, he was angry just about being there. He was angry with his staff. I found out that his wife had passed away 5 weeks earlier, and they'd been married for 63 years. He was grieving terribly. I stayed with him and I held his hand, and he explained everything. He told me the whole story. We cried, and he gave me a hug, and I left. Before I got ready to leave that day, I thought, oh, I'll go back in and see how he's doing. When I did, he was sitting up on the side of the bed, and he was actually smiling, and he said, "Miss Kay, thank you for coming in."
Training for patient hosts and all related costs are free to volunteers. Requested volunteer time is approximately 3 4-hour days each month. but can be flexible to fit your schedule. If you'd like to be considered for a patient host role, please contact the Allegiance Health Marketing and Communications Department at 517-841-7491 to learn more, or visit our website at allegiancehealth.org/communitypartners.
You know, it's amazing how many say, "Oh, thank you so much for coming by." And that goes for all the people in our group, because we all do much the same thing. But it's, you know, it gets you. It really gets you.